All right, as I mentioned at the top of the program, 12 states have now issued stay-at-home orders, including my home state of Louisiana, as coronavirus cases rise across the country to over 25,000. That number may seem small compared to the annual number of flu cases, but the contagion rate and the potency of the coronavirus is much different than the flu. Here to explain is Johns Hopkins health policy expert and surgeon, Dr. Martin Makary. Doctor, welcome to Washington Watch.
Thanks for having me on, Tony.
I want to start with this. I'm hearing it. I got phone calls over the weekend. People say, oh, this is more. They're making more out of this than they should. We've got 61,000 people died of the flu in 2017-18 flu season. What is the difference, doctor, between the flu and the coronavirus?
Well, I think number one, it has a higher transmissibility quotient. That is, every person that gets it will on average give it to more people than the regular seasonal flu, in part because of a longer incubation period, in part because for most people their symptoms are mild or no symptoms. And the other big factor is the case fatality rate, which is somewhere around 1%. So those two things in combination have led many to create prediction models that have suggested that as many as 40, 50, or 60% of the population in any country will get this. And what we're seeing in Italy is exactly that playbook being carried out. And it's the same in Spain. It's the same around the country. And one thing that's very clear is that although China has not been transparent with their numbers and Iran has not been transparent with their numbers, we are watching this play out in other parts of the world that are showing that this virus knows no borders and it knows no politics, and it basically it continues by person-to-person transmission. Now, the American exceptionalism idea is a great idea, but it doesn't apply to the immune system. And I think that's what we need to remember.
But it can apply to our response if we are on top of it and we have a good healthcare system. But this, and I think the actions that are being taken, the stay-at-home orders, are all designed to keep our healthcare system, which is designed to, accommodate normal healthcare needs, so that it's not overrun at one particular time, and we would have to start rationing healthcare. Is that what's behind some of these orders?
Yes, that's exactly right, Tony. And look, I'm not an alarmist or a conspiracist by nature. I'm really just a scientist, but looking at the data and looking at what's happening already in New York City and Washington State, we are not about to be overrun. Some of our hospitals are already overrun. And looking at the fact that we are 4 weeks roughly before our peak of this infection, we run the serious risk of being in a state of rationing care, something we've, haven't really come to grips with. I hope it's wrong, but this is a hurricane coming to the United States like Hurricane Katrina. It's on a straight course for the U.S., except it's 100 times worse. And I think what we can do right now is hunker down and do our best to take care of those who are most vulnerable. The data from Italy is pretty clear. They're rationing care, and they've got limited resources, and they did a lockdown early. Now, look, there's differences between the U.S. and Italy, but we're 6 times bigger. And so accounting for the different differences, adjusting for our population and age, what they are seeing there and seeing about 800 deaths in a single day would translate to 4,000 Americans dying in a single day. And again, that's weeks before the peak. That's what we're worried about. We only have 100,000 ICU beds in the U.S. We can maybe double that or triple that. And we've seen people come together at 9/11 where we cleared half the hospital beds to get ready for the storm. So we can increase our capacity, but our concern is we just can't do it to the magnitude that there will be need during those few weeks where we run the risk of rationing. So this is our time to come together. This is our time to call those who are vulnerable and drop off a package for them, make sure they're okay. This is our moment to shine, and I think we're going to need all hands on deck.
Well, Dr. Makary, you mentioned Katrina. I lived through that, was a part of the response to that in my home state of Louisiana. And we've gone through a number of natural disasters in Louisiana, but here's the thing that's a little bit different. In those particular cases, we can rely on other parts of the nation to help. This is one in which the entire nation is being affected and taxed. And so there's really no place to look for help. We're it. And as you said, we've got to come together in this sense. And I just want to dispel the notion among people who are saying, oh, this is nothing new. We've got, as I mentioned, 61,000 people died in the 17-18 flu season. This, and I have a daughter who is an ER nurse. And so I have a little bit of insight on how this is working. And I noticed today, Surgeon General talked about how we're not going to, and I'm quoting, we're not going to ventilate our way out of this problem. This is the only treatment for those in the serious cases are the ventilators, and that seems to be one of those devices that is in seriously short supply. And that's where we get into the healthcare rationing that may have to take place.
Yeah, I mean, if we just do the math, we don't have the resources. And so the only thing we can do is to do everything possible to stop the transmission in its tracks. I mean, let's look at let's take the lowest end of the estimates that are coming out of Harvard, and they're coming out of New York State, and they're coming out of epidemiology. Let's say instead of the 40% of the public getting the infection, that's the low end of the range. Let's take half of that. Let's say 20% gets it, which is getting close to the proportion that get the seasonal flu each year. If 20% of 350 million people get this infection, that's 70 million people. A 1% case fatality rate is a lot of people, right? That's a lot of people. That's 700,000 people. We only have 100,000 ICU beds. So right now, New York is reporting a 15% hospitalization rate. To take 70 million people and say we need a hospital bed for 15% of that, we're nowhere even close. So the math is very clear. And if you that's, again, taking that's cutting in half the low end of the range. It could be worse. We don't want to create hysteria.
Right.
We don't want people to panic, but there are things we can do to get ready. And the biggest battle, in my opinion, is public awareness.
Yeah.
People are changing their minds and realizing, hey, we can't blow this off. This is not a joke. This is real.
Okay, so the threat is real. We've established that fact. Now let's talk about the precaution, what every American needs to do. You talked about taking care of the elderly, those at risk, letting them stay at home and drop groceries off at the door. But we've got to take these, the social distancing recommendations serious. Those in states that are at high risk, the stay-at-home orders. I mean, these are put out there for a purpose, and if we just forget all of that and move forward as if nothing is happening just because we're not sick, we could be transmitters of the virus, and we're only going to move us toward I wouldn't say a worst case scenario, but we're certainly not helping.
Well, thanks for bringing up the social distancing piece, because we talk about it, but I think there are subtle things we don't think about. For example, our telephones are extensions of our hands. And when we wash our hands and go back to using our phones, that's a mode of transmission. When you fill up gas, when you exchange your credit card or money at the counter, even at a grocery store, those are times we've got to just be super, super diligent about all the little ways that bacteria can spread by contact. Common surfaces. Make sure anyone who's high risk is not the workforce right now, and they are isolated. They're protected. They can be outside. The sunlight is wonderful, okay? The virus does not like sunlight, does not like the outdoors environment. But if you can social distance even on your property or somewhere outdoors, that's okay. But think about those with organ transplants, those on chemo, those who are over 60 or 65 years of age, those who have diabetes or lung disease, those who smoke or vape. We're really worried about those individuals as having a higher case fatality rate. That is, we know this virus, thanks to God's grace, is relatively sparing of kids. There's only been one kid that's been reported who's died from this, who's been healthy, and that was a case from China. Not all the data's in yet. We know kids can get the infection, they can spread the infection, but it's rare for anybody under age 12. for a kid to die from it. Once you start getting older, even starting after age 40, this is where it starts getting close to home for me as a healthcare worker, because those of us in healthcare are at the highest risk.
Yeah.
That inflection point starts to increase. That case fatality goes up, and it goes up with advanced age.
Dr. Makary, we're almost out of time, but the people are saying, well, the recommendations keep changing. We were at groups of 250, then 50, then 10. Is that because you talked about the models earlier? It's because we don't know what this coronavirus is like. We're discovering this as we go along, and so as the models change, we've got to change our behavior.
That's exactly right, Tony. When the stories started coming out of Wuhan, China, that they were building tent hospitals, and in a town of 10 million, they built 23 field hospitals and still were overrun in rationing, we didn't know whether or not to believe them. And so, with our American optimism, we were hoping for the best. We were hoping it was going to be contained. We were hoping we didn't have to deal with this. But some of us in public health called physicians over there. We would remind those in the media, they have phones in China, and you can talk to the doctors. And sure enough, those were real stories. And that's when we started telling folks, we've got to get prepared. What's the risk of being over-prepared? And looking back and saying it wasn't quite as bad as the projections.
Well, that would be a much better scenario to be over-prepared than under-prepared. Dr. Makary, thanks so much for taking time out of your busy day to join us. Very insightful, very helpful, and we'll continue to encourage people to follow those guidelines to keep themselves and others safe and healthy. Doctor, have a great day.
Thanks for having me.